One of the things that I was sitting there thinking about on a political note is it appears that Democrats tax and spend and Republicans borrow and spend. So I see a question right here in front. If you would just, the microphone will come down to you, and if you would stand up and identify yourself and your organization and direct your question to the panel or to one specific person.
Hi, Cindy Enos, Copal Solutions. Jim and Bill, I wanted to ask you to give us a better understanding of Jerome Powell's remarks related to why the U.S. lags so far behind other countries in labor force participation, and the opining that it relates to opioid use, generous benefits versus education was what Jerome Powell really focused on. But could you discuss that? Because it is a very remarkable finding in the face of such low unemployment rates.
First, pretentious on my part to point out that Jay Powell was a fellow with me at the Bipartisan Policy Center before he went over to the Fed. I don't have a good answer to that. I asked Jim to answer first, but he didn't. I do think I come from an area of the country where you cannot deny the impact that an economic slowdown in the Midwest and some of the industrial areas, and particularly what translated into depression and later disabilities particularly, that then led to opioids, was a major factor in that particular age bracket of men leaving the workforce. And so I do think healthcare does play a major role in the participation rate. And that's about all I can say. I do think it's a factor, and I think that Jay was right in pointing it out.
I think it's really, the more you look at what's going on, you realize that demographics touches a lot of things we watch. And what I don't know is this related to, but the population is aging. We know that. So I don't know, and we know suicide rates are up. And the economy is in great shape, but for a lot of people, that's not so. And that's what that income divide is about. So it's hard to know how much the economic environment is contributing to this. The stresses for the older workers, the life is getting more challenging, the population's aging. We just don't have enough information to control for all those factors. So I don't really know what he's thinking about. I think what we all feel is running a high-pressure economy does a lot of good things. It benefits people at the bottom more than anything, is what we know. But I think we're all kind of struggling to figure out we don't know all of the factors that are contributing to the opioid crisis. So I don't really know I don't know where he's coming from. I don't know that field that he's drawing on.
Question down here in the front.
Do you want to go first? Oh, okay.
Are you going to fight over it?
Fighting over the microphone. Diane Nugent. I take care of adults and children with chronic complex blood disorders. The fourth time here. I love this conference. Thank you. I think, though, that an important feature, both for Bill and Liz, that we neglect to point out, and it's just come out, we heard this at the NIH 2 months ago, is the shortening life expectancy for adults between 25 and 64. And this started back in the 80s. And it's reaching a tipping point now where we as a nation, for the first time, have a shorter life expectancy, not in our old folks, and it's not the deaths of despair that are associated with the opioid crisis. Steve Wolf from the Virginia Commonwealth presented this nationally and in the publications. And Bill, your data showing increased funding of Medicaid and CHIP correlates with the fact that those two groups are not experiencing a shortening of their life expectancy. The group that's dying are the maternal. We have our maternal mortality around childbirth, one of the canaries in the cage, is worse than Turkey and Vietnam right now. We're one of the worst countries for that. And if you look at mortality, women were flatlining, men it's worse. And your area, Virginia, Ohio, it's the very worst.
I know.
And what Steve is saying is that this is an access to healthcare issue. This is people not paying for their pharmaceuticals. They're not paying to go to the hospital in a timely fashion. And so I would like you to include that curve next time you present, because I'm one of those people saying, what went on in the 80s and 90s that we're losing so much ground, that we're having to pay so much more? And the uprising, I think, Liz, that you're talking about is that people who are paying for this now see the lack of value that you've all been talking about for the last 4 years. I hand off to you. Just include that curve.
Be happy to do that.
have
I
time
would make
for
one.
another question?
I'll make one quick observation, as we have a little project going on rural health, and looking particularly at those areas, and on maternal mortality and issues that you raise. I think everybody knows that California is an expansion state, right, for Medicaid. That is very highly correlated, those states that did not expand Medicaid, with the issue that you raised. But I also will say to Liz's presentation, we came out with a report last 2 weeks ago, which took us 3 years to put together, with Senator Daschle and Senator Frist and Gail Walensky and Andy Slavitt, a group of 10 healthcare policy analysts. And the one area which, for a budgeteer, is a little controversial for me, but that particular category, say from 400% to 600%, that's where the difficulty lies. And so we actually recommended an expansion of the subsidies for that particular group in the Affordable Care Act.
Can we type one more question?
My question is for Jim Walter Unger.
Introduce yourself.
Jim, in your slide in which you present data on real hourly compensation, are employee benefits included or excluded in
It's
the
the whole
computation?
It's the whole bundle. It's the healthcare benefits, vacation benefits, time off. The employment cost index is where we get that from.
Okay.
So it's the real, that correlates with the divide of income going to workers and income going to that. If that picture were not, if that were more lined up, you wouldn't see this divide happening. It's happening because worker pay is not keeping up with labor productivity. So more and more of that benefit's going to the owners of robots and AI. This is an Amazon, Uber, Lyft phenomenon. We call them the superstar firms. It's about innovation, a lot of it.
Mm-hmm. Thank you.
All right, I wanted to just thank Liz and Bill and Jim for kicking off this conference. A lot of information. Everybody be back here at 10 o'clock for the next session.